ECCMID TV. You're with Michael Jackson, your host for ECCMID TV 2016. And joining us now, our special guest from Melbourne in Australia, is Dr. Benjamin Howden, who's an expert in infectious diseases and a medical microbiologist who will be joining us in Amsterdam for this year's Congress. Professor, it's lovely to have you with us. Good morning, good afternoon to you. World time zones are always a bit crazy. How are you, sir?
Very good, thank you. It's good to be with you.
Now, going into ECCMID, in terms of the presentation that you're going to be delivering, sir, what can we be looking forward to?
Well, I'm going to be talking about Staphylococcus aureus, which is a major pathogen of humans, and in particular antibiotic resistance in Staph aureus, and mainly focusing on vancomycin resistance, how this has emerged, how this impacts on how we test and treat patients, and then also how we're using genomic studies to try and understand this new resistance mechanism that's emerged over the last decade or so.
Is antibacterial resistance quite a major problem in your field of study now, sir?
Yeah, well, I think it's one of the key things. I work in public health and clinical microbiology, and antibiotic resistance is a daily problem for us, and that's in Australia, but also globally, and actually more so globally than necessarily in Australia at the moment. But we're increasingly burdened by resistance, and Staph aureus is just one of many problems in that area.
So are we looking for new antibiotics for old microbes, perhaps?
Very much so. But there's two things. We're looking to better use the old antibiotics, so understand them a bit better, and that's part of what I do, is trying to understand how resistance to vancomycin impacts our treatment decision choices, but also, obviously, we need new antibiotic classes as well.
What do you consider significant right now for patients' therapy and diagnostics in relation to the research that you've published in the past and are working on currently, sir?
So the main thing I've been focusing on is understanding whether we can still use vancomycin. It's a drug that's been around for many years, and there's been a lot of negative literature about this drug because of concerns about poor outcomes. And I've really been trying systematically to understand whether it's still an important drug for treatment of Staph aureus, and I think it is in the right situation. But we also have to understand its limitations and how new resistance issues are emerging, and how actually if an isolate is vancomycin resistant, it can be co-resistant to other antibiotics, and that's very important when making decisions about how to treat patients.
Now, turning to ECCMID itself, sir, from the ESCMID stable, how important is this Congress gathering in Amsterdam for you personally in your work?
Oh, well, I'm very excited to be presenting at ECCMID. You know, it's a fantastic international conference. It's one, the biggest international conference in this area globally. And so I'm very excited to be there, and I think it's important for me, being in Australia, which is obviously a long way from most places, to be able to interact with people from the European continent and the rest of the world, and talk about my research and then compare this to what's going on internationally.
The associative levels that ESCMID provides through this ECCMID Congress are indeed first rate. Is that the most important thing for you, though, the networking or presenting your paper? What really lights your fire about ECCMID 16?
Well, what do I enjoy? I enjoy seeing what everyone else is up to, and the cutting edge science that's going on, and particularly networking is very important, and having the opportunity to present my work or the work of my lab and the people I work with, because it's much bigger than just me, and then seeing what the feedback is and getting new ideas that are generated from those discussions.
Well, we're delighted to have you at ECCMID this year, so we're so looking forward to listening to you present your paper. We look forward to meeting up with you live in Amsterdam, but thanks for sharing your thoughts with us on ECCMID TV in advance this morning.
Thanks very much, Mike. Good to speak to you.
An absolute pleasure, sir. Thank you very much indeed.